Sugnana Kothapally. He is from Hyderabad, Telangana, and he is PGT from Department of Case Taking and Repertory. Today, he will be sharing with us two interesting cases of infertility. Welcome, Dr. Sugnana.
Thank you, Dee. Hello everyone, this is Dr. Kothapally Sugnan. First of all, I like to thank Dr. Heena for having me here. I have treated two infertility cases recently. I'll be discussing about them. First case is a 29 years female. She's a working woman, and she has been married since 6 years, and there was a failed pregnancy 5 years ago after 1 year of marriage, and she's been a known case of PCOD since 10 to 12 years, and allopathy surgeons have suggested her laparoscopy, but she denied it. They were trying, and there was a history of IUI. It was failed, and the presenting complaint, like, she came to me in March 2023, and the presenting complaints were irregular menses. It was late and scanty, and there was leukorrhea, and it is secondary infertility. And coming to the detailed case taking, I have formed a totality. Mainly the mentals were disappointment was there, disappointment of love, in the sense related to the relationship with her husband and his family and her family as well, and there was indifference to the family, and she's insecure about her appearance and insecurity financially. And second, coming to the physical general, she's chronically constipated, she's a hot patient, she desired sweets, and late and scanty menses was intense. This was a totality. Based on the totality, I have prescribed her natrimure in LM potency for 3 months. Yeah, in June 2023, UPT was positive, and she delivered a healthy baby boy in January, and both mom and baby are apparently healthy. And coming to the second case, this is interesting one. She's 35 years old lady. She's an illiterate. She's a daily wage worker, and she's been trying to conceive since 18 years. She was married when she was 17 years old, and since then she was trying to conceive. And there is no history of abortion, nothing. This is a case of primary infertility. And she came to me in August 2023, and they were trying for pregnancy, and for the presenting complaints were late and scanty menses initially, but since 4 years it is heavy menses. Like, she's been suffering from menstrual bleeding. Apparently it is 4 times a month, 3 to 4 times a month, and each time it is like 4 days of bleeding, and she would change 2 pads every day. And she's also a known case of PCOD. Coming to the first case, it was scanty. It is profuse menstruation, and both cases are PCOD. And interestingly, the totality is disappointment and indifference. This is like profound indifference towards family and everything. During case taking also, my observation was she's indifferent to give answers. She's very dull, and there is profound sadness in her face. This was the totality. And coming to the physical generals, she's also a hot patient. She also desired sweets, and there is immense pain, lower abdomen pain during menses. This was the totality, and based on the symptoms, I have given her sepia in LM potency for 3 months, and she came with the good news in January that her UPT was positive, and now her EDD is in next month, and I have inquired her about her health, and she's doing fine now. So this is the totality.
So those were very interesting cases of infertility. So you said you have prescribed first case natrimure,
Yeah.
and in second the prescription was sepia,
Yeah.
right? But in both cases, indifference was something you found.
Yeah, indifference and disappointment.
Disappointment, okay, but usually what we think and we have in mind that indifference is more in sepia.
Yeah.
Yeah. But in natural mule, that indifference part, how you will differentiate it from sepia indifference?
Yep. First case was Nattermere, and second is sepia. I have, when I formed a totality and repertorized it, for two cases, the first two remedies were Nattermere and sepia.
Okay.
So my main challenge was differentiating them.
Right.
And here apparently both of them were disappointed. Both of them were presenting indifference to the family. And second case, she is indifferent to everything. In the sense during case taking, to me also,
Okay.
to the neighbors, everything. It is like indifference is shown on the face. But the first patient was indifferent only to the family. But when she was with me, she's not indifferent because I'm not related to her. Can you understand?
Yeah.
So here, main challenge was differentiating Nattermere and sepia. Nattermere, coming to Nattermere, the main core theme of Nattermere is around relationships.
Right.
Here, the patient is well read, she's a working woman, and she's earning enough money, she can have a peaceful life, yet she needs recognition, appreciation from her husband, her family, like in-laws and everyone. And she's telling that I'm doing so much but I'm not getting that reciprocation, like love and appreciation. I'm doing this much for them but I'm not getting that back. And initially in her marriage she tried more than what she can do, but still she's not getting what she was expecting from them, and slowly she shut her emotions down and she became indifferent to them, not to the society.
Yeah. Okay.
So the indifference and the disappointment is with the relationship only. But when it comes to sepia, it is completely, she's a daily wage worker, and she's illiterate, and she was married when she is 17 years old.
Okay.
And according to her, she was not willing to get married.
Okay.
She was having different dreams, but her family forced her to do it. After that, she adjusted in the in-laws family, but then they started pressuring for a baby. Obviously, that is the main concern in the families, right? Bearing a baby. But she's been trying for 17 years. It's a long time. Pressure from family, tantrum, society, everything. And she was bearing it. And slowly, that became a disappointment, and that indifference is being shown to everyone. It's not about the family only. So here Rajan Shankaran has clearly, like he beautifully explains it, that disappointment of sepia is a larger sphere where Nattermere is a little part of it. Sepia will be indifferent, disappoint with every sphere of her life, but Nattermere is only one part, that only relationship part. So that was the main core point for me to prescribe Nattermere in the first case and sepia in the second case. And the remedies were so short that the cases gave positive results within 2 to 3 months. That was very interesting for me, because usually we expect infertility cases like 6 months, 7 months, but that was a good point for me. Yeah.
And the thing is that you were able to differentiate and then prescribe, okay?
Yeah.
Not being being prejudiced or something like
Yeah.
that. And the thing is that in infertility cases we can't prescribe anything specific or related to those the symptoms. All we need is to go into the depth. Okay.
Yeah.
Heena?
Yeah.
The core we have to find out what is the causation, and I think constitutional medicine is what works best in such cases.
Infertility, in a sense, it is giving a progeny. Like, it is more dynamic than any other condition.
True.
Here, in both cases, there were problems with menses. Second case, it was lot of bleeding. I could have easily given some specific. Yeah, but I've chosen to go to the more dynamic dosage and selection of remedy than going to the specifics or only based on presenting complaints.
And that is the reason you got result in like the short span of
Yeah.
time. Na?
Yeah.
She was trying since like 17 years.
17 years,
she
but
must have been to many doctors, many different treatments, and then so yeah, that was really good. Other thing I would like to ask is what about the partners? Like now, what how they were healthy or they had some issues, health issues, or
partners. First case, the husband of that patient was having allergic rhinitis, and he was also having some problem with the semen analysis. It was low volume. There was oligospermia as well, but main like I have given him according to my selection of remedy based on the presenting things, and both of them were having medicines concurrently for 3 months, and he's feeling better now. There is no allergic aggravations now. And coming to the second patient, husband was apparently healthy. There were no issues, so I didn't consider him for the treatment. But my suggestion is you have to treat both of them. At least, yeah, simultaneously you have to know both of the history, because it is 50-50. You cannot give only treatment to the
we should know both sides of the story.
yeah, both sides of the story is very important. Apparently second patient's husband was completely healthy and he was not willing to take the medicine, but she was lucky enough that positive thing happened.
Right, and diet, about the diet, lifestyle, that plays a very important role
Yeah,
in
yeah,
PCOS.
that is very important, because in this generation where there is like a lot of sedentary thing, right? First patient was apparently she's working woman and she'll be sitting and working. It's not like some physical thing. So I have suggested her for change of diet, high protein diet, and doing a lot of exercise. And they both connected, like emotionally they connected while having that physical exercise. Like they used to go for walk every day. So that could give the boost to work on some goal, right? So diet and regimen is also very important in these type of cases.
Yeah, right. PCOS, because it is
Yeah,
lifestyle
PC.
disease, we
Yeah.
can say, na?
Yeah.
And these days we have a lot many cases of infertility, PCOS, and
Apparently it is like 25 to 40 million infertility cases in India.
that is a huge number.
That is a huge number, and homeopathy has great scope in it.
Absolutely. Because people are spending like anything on IVF
Yeah.
and all different things, and your cases have proved that homeopathy has a great role to play here, and without giving a economical burden to the patient, and in a short span of time.
Yeah.
So,
Before going to IUI, IVF, I think people should give a chance to homeopathy. Or else, if they are having some allopathic treatment, they can use homeopathy as an adjuvant, because that will fasten the recovery. Like they can have good results in a shorter time. See, directly going to IVF, IUI will lead to one or other kind of side effects.
and what
That should be the final
one.
final
No,
one.
but with IVF also, what I have seen in many patients, it is failed. Like one first, second
Yeah,
try,
yeah.
they will not conceive with it. Even if they do,
But there will be a bombardment of all the steroids and hormones.
so many.
It will definitely lead to one or other condition in that patient.
And what you will say, or what you think about females being on OCPs? That is I think is one of important or major cause for getting this infertility issues, like
Yeah.
issues these days.
Yeah.
So that is
That has
also,
to be considered.
yeah, that OCPs and stress and so many factors. It is
Yeah.
multifactorial. So that
It is multifactorial. That's why we need homeopathy here, because we treat based on the individuality. We treat based on their mind, their lifestyle, their dietary habits. We will consider everything. We go through their they eat something, but we look into why they eat that. Like there will be a depression kind of thing. They crave for the dopamine rush, right? So it is not about what they are eating. It is why they are eating. The reason why the mind, what is happening inside her, and we treat it.
Yeah, that is what is the beauty of homeopathy and this. So that is the constitutional medicine.
Yeah.
Because we need to consider the mind of the patient, the mental state of the patient, and we have to go to the depth to find out the cause. Okay, why it has happened? Because conceiving is a natural phenomena of females. Our body are made for that purpose. Okay, and if it is not happening, then
that is the biggest dynamic thing, no? Like that is the main point.
Yeah. So that was really great learning, Dr. Sugna. It was really great to have you and discuss cases with you. And I really hope that after going through this video, many people will get benefit with homeopathy and they will consider homeopathy for all the infertility PCOS cases before going to other mode of treatment. So thank you so much.
Thank you so much, Steve. Thank you so much for having me here. Thank you.
Okay. Thank you so much everyone for watching. Hope you enjoy. See you all in